I like how it starts at 6.
Yeah.
Welcome, everybody, to Unprofessional. We are two anonymous medical... Well, I'm a medical
MDs.
student. You're a
MDs.
goddamn resident.
No, you're an MD as well. We're both MDs.
We're both MDs. We're both doctors. But I'm still doing my shit.
Not a practicing doctor yet, but as soon as you graduate, you can call yourself an MD.
We're doctors, and we hang out with you, basically. And we give you the unfiltered scoop on the latest discoveries in health and medicine. And boy, oh boy, do we have a show for you.
Don't say that, because the first story is not medicine related at all.
In fact, we're giving away the solution to all your problems for free. And
as long as they're medical related.
This whole episode will be about medicine. Okay. You had a story to start us out?
Yeah.
Dr. Ken?
So, I don't know why you said we're talking about medicine, because it's not medicine related. It's about simping.
Okay.
Are you familiar with the term?
If you couldn't tell, Dr. Ken is single right now, but enlighten us at what simping is. Dr. Ken.
I don't know what the definition is, but it's like when you're so into a girl that like you do anything for her and you're just too nice, you get basically taken advantage of because you're hoping that you get rewarded in some way, right?
Yeah.
And so I heard the biggest simp story about someone that we both know.
Oh no.
And I had never put pieces together, but I hung out with, my friend the other day, and he told me about someone. I'll tell you the name, in a bit or something, but he said that, this girl and this guy are dating.
Okay.
And, they've been going out for a few years since SGU. But this guy knew the girl before she started dating this other guy. Let's call him
on the
island. Let's call him S for simp.
S for simp. Okay.
Yeah. So S and then the guy and the girl that are dating. Okay. So S apparently has been like making a lot of jokes, lately that are kind of cringe. Almost to the level of, hey, it'd be so funny if we kissed,
Oh, no.
Those kinds of dates or those kinds of jokes.
Okay.
And then a picture just surfaced where the guy and the girl are walking, and S is behind them holding an umbrella, and it's raining.
Wait, did he post that?
No, someone took that picture because he was doing it.
Oh, it literally happened.
Yeah, it's a real thing, dude. Yeah. I was shocked to hear that.
S held the umbrella for the guy and the girl?
Yeah.
No.
S is behind the umbrella, holding it up for them, so he's getting wet and they're staying dry.
No, that's
and
fake, bro.
The fun. It's a real picture, bro. I saw it. And the funny thing is that I remember on campus you were talking to this guy and you were like, "Yo, what kind of girls do you like? Maybe you could go to the club together and I'll show you like, I could show you how to pick up girls and do whatever." Yeah. Do you remember? Do you know who I'm talking about?
I mean, I feel like I did that with like 2 people, so I'm not sure.
Okay. Anyway, when I heard that, I was like blown away, and this guy has not dated anyone or like shown any interest in anyone in the past 3 years. But so everything just clicked when I heard that.
Can you type it in the chat? Type the name in the chat for me. This is the worst content of all time. That's crazy, man. And that's just so terrifying. That's like the one thing we gotta avoid, boys. We're better than that.
I hope the chat is not visible to like the audience.
No, I don't think so. Oh no, poor guy. Dude, I was there for him, bro. I'm like, whatever you need, man. I got you. I fucking love that kid.
Do you remember having this talk?
Yeah, I remember talking to him about that now, yeah. How did you...
Yeah.
Did I tell you about that we talked about that with him?
I was there with you, bro.
Oh, okay.
I pretend not to listen, but I'm always like eavesdropping.
That's sad, bro.
Yeah.
We're better than that, boys.
It's surprising because you think like it's something that happens like earlier than life, when you don't have a lot of like things going for you, but then this guy's
if you put it off, then you could do that your whole life. You know what I mean?
Yeah.
If you don't like come to the realization early on, then you don't come to it, until you come to it. Like,
how do you cure this guy,
I think it's tough because it's the classic. You can bring a horse to water, but you can't make him drink. But it's like, for instance, with you, like it was like a pretty quick transition. It was like, look, you're doing these types of things. You're sending out these types of messages and things, and you're kind of
You're
simping a
sipping
little.
too much.
You're being a little bit of a bitch, but you put it lightly, and it's like this is what I observe, and this is how the world I believe really is, and this is the evidence for it. And like I kind of did that with you, and you were pretty quick to realize, like, I wasn't the sole proprietor of this. Other people shown things, and you've seen it yourself before that too. But eventually, enough things click, and you're like, fuck. The world isn't how I thought it was. You know what I mean? And I should change how I interact with it. And and some people, it's a pretty, not a smooth transition, but it's not as painful or long like I think yours was. It wasn't painful or long. And then, our boy who we're talking about in question, it's a tough thing. And he's just so buried in it that it's going to be a harder process probably to pull out of it.
Yeah.
But,
and like my friend was telling me stories, and he's like, they've had this group for so long, and the group is like pretty, static. It doesn't really change. No new people entering or exiting. So it's just like, what do you do at that point? Do you feel like you're too far gone?
It's tough.
Yeah, I don't know.
He's really far gone. You need some kind of mentor, though, someone to teach you how to get out of it. But they can't make you drink, and that's the most important part. So you just if you're in that group, or if you do talk to that guy still, then it's kind of like a look. I don't know. It's almost like I know the answers and I know how to get around this, and I know that you probably feel like in a tough place right now, and do your best to like hear him out and understand him first, and then be like. And I know how to not feel like that, and to like be able to take control of like your life and your dating life and stuff. So if you're interested, just hit me up whenever. Like, put it in a more delicate way, but like, yeah, I think that's kind of it, though. And
I think it's hard to.
The bottom line is they're not going to hit you up right away, and definitely not during that conversation. Like,
well, it's been 2 years.
With you, it was complete. It was denial. It's like, look, that's not. Like you laughed at me, you know what I mean? Like what?
I still do.
Yeah, you still laugh at me constantly. And you eventually came around, but yeah, you just don't believe it at first, and
even if you understand it, you might be like, I'm so out of my depth here on like how to proceed that you just don't, you're stuck where you are. Yeah, and I think it's really hard to make those changes when you like. I think you have to get a different group. Because when I was back home, I was so used to the same thing. And then when I went to school with SGU, it was completely different. You meet all types of different people.
For me, the changes happened when I went to like this different restaurant and whatever, like the like people were dating within it and stuff. Then there was like a big shift for me. And then I started to like go and look into those kinds of things. I got hurt, that kind of stuff. And then I started to look like, how do I get out of this? And so I looked up, an online mentor pretty much. And then got that through girlschase.com, who is our sponsor for this.
Every episode we're going to sponsor them.
Every episode is sponsored by girlschase.com. They give us a high five.
I remember you telling me that, like, you can get past the paywall on their articles. And I was like, what the fuck? There's a paywall.
Don't tell them that.
It's funny. I think, like, people are going to, like, think, oh, Trevor, you get so many girls. He's, like, judging this guy, but I think we should make people aware, I think we've both been through the same thing.
Yeah,
like,
bro,
we were simps too. Not
100%.
Not to like this extent, but
yeah,
I think we were both
and that's the point we're making is like, dang, we got out of this earlier, and thank God, we did. But everyone's time comes when the time comes. Some people figured it out when they were fucking like 12 years old. You know what I mean? They've been balling since then. But
that's all they knew.
For me, it took until whatever, like 25, whatever the fuck it was. So.
Yeah,
just it is what it is, but there is hope. But yeah, we both went through it for sure, dude. 100%. I was a little baby back bitch, baby back bitch. And it's not even about being like a bitch or not. It's like I just felt like I had no control over my life or dating life or anything. And I just read a book called The Courage to Be Disliked, and it's like more of a philosophical take on stuff, but it's like. Its stance is that all problems you have in the world are interpersonal relationship problems, and then it like it talks about how that possibly could be, and
probably,
and then why having the courage to be disliked is so important and stuff. But anyway, it's a whole novel. But
like I just want to make it clear, like I don't think like we judge people that do these things. It's like
100% not.
You
there's
see
like
it,
judgment there, but
I don't think there's judgment because like if they were willing to like come and be like, hey, I wouldn't accept them any less,
Oh,
for these
dude,
things.
if anyone came to me for help on this subject, I respect them so much. In fact, they become one of my brothers. Like literally, like that is amazing. Like
Brothers in
there's
arms.
to have the courage to like look yourself in the face and be like, look, my mental model of the world isn't correct, and I'm willing to humble myself to look for help somewhere else. It's just like, damn, bro, about to bring a fucking tear to my eyes, son. Let's get this money. You know what I mean? I'll set aside my whole shit and let's work on what we got to do. You know what I mean? I'll write up a whole goddamn plan. You know what? Let's change the podcast. It's no longer unprofessional. It is now the dating doctor with Dr. Trevor and Dr. Ken. Hit us
One
up,
of us
guys.
has a lot more inputs than the other.
Yeah. The other one.
Let me ask you this. I think I have a good quote, and I think it fits in with this. Let me know what you think. No one will ever respect you because you do not respect yourself. Do you think that fits here?
Yeah, definitely, 100%. And that's one of the things that this book goes on about too. Is like one of the most basic things you have to do is find self-worth and like respect yourself for who you are. And that's so like ooey gooey and shit, but when you do it like foundationally, like, look, I have worth in the world. Like I do, like just me being here is like worthy. I make this person happy. I do this kind of a thing. It's not even necessarily your actions, but like, look, I have worth because I'm human and I'm here. Like, and you respect yourself in that way, then things can build. And then you find yourself when you start on that little tiny level, that very first little step of like courage. Then you're like, like the guy we're talking about. You start to when you're holding that umbrella for that couple, you go. Maybe something's off here.
Yeah,
you know what I mean?
I don't
like
respect
you're like
myself.
I don't know if this is like I don't know if I think I'm worth more than this. You know what I mean?
Yeah.
And that's how the changes start happening. You don't go from like, oh, I tell you a few things and then now you're some fucking stud or, whatever. It's this gradual process of first, respecting yourself and then going from there. So yeah.
I think honestly, like nothing matters, honestly, relationships or otherwise, but as long as you have that respect for yourself, things will come. A lot of people in my life that I've interacted with had, these issues. I think everything stems from like insecurity. I think like I need to write my own philosophical book about my theory on how everything is driven by insecurity. And I think a lot of people have it on their sleeve. It's easier if you say the wrong thing, they're going to flip out at you. And some other people have it buried deep and they don't respond as much, and some people honestly like are at that phase where they are just happy with who they are and they have they control their insecurities, they accept them, and they respect themselves. And I think people need to get to that level and like just face your insecurities, and it'll be better for you in the long run.
Oh, 100%, man. And yeah, I mean that goes along with like self-respect and everything, and every problem is an interpersonal relationship problem. Like that's where insecurities stem from. And so once you start to like realize those kinds of things, like look, how I interact with the people I interact with is almost everything. Like how I interact with my community is the world. It's not, of course it's about, your like whatever, your productivity and how you study with this and do all that, but like first it's how do I interact with people, and do I like respect myself in those scenarios, and how do I do that? And it's way bigger than people think. And like one more thing I'll talk about with this book is the world is so fixed, or at least like the US is so fixed on Freudian psychology and stuff, how it's so they say ideological based, so it's cause and effect. I was shit on as a kid, whatever, by my brothers, for instance, and that's why I'm insecure about this. And so if you look at it that way, bro, how do you escape that? Because you said this happened, so this. And it's like I can't escape that. But if you look at it instead, I'm choosing to feel insecure about it because I'm avoiding, interacting with people, then it's a lot easier to fight it, because you're like, oh, it's a choice that I'm staying inside all day, or being afraid of this. Like that's a choice, because then it keeps you safe from ever trying to do it. And
I think one of like the most common things that I see in like daily life is like little man syndrome. Like, I don't know what your experience has been, but it's been like either two things. Like, if you're insecure about it, you overcompensate and you try to be bigger than you are by exerting your will, or the other way where you try to be meek and like you, I don't know, undercompensate. You know, you try to make yourself smaller and you try to make yourself like a joke and self-deprecate. And I think both ways, I think, I've met more like the overcompensating type, and it's just really difficult to deal with because these kind of people are more difficult to talk to. But I feel like, you should ask yourself at the end of the day, how is my life different with this insecurity? And most of the time, it's not. It's just you're living your life. Sure, things are a little harder, for whatever reason. Dating might be a little harder if you're like 5'2" or some shit. But at the end of the day, you're still healthy. You're living your life. Like, those people with like cerebral palsy have something to like really complain about because they, their whole life is affected. But I think like with small things, like you have to get some context and see how your life is. Most of the time, it's not going to change.
What do you mean? Oh, what do you mean when you look at the insecurity like in the face?
Yeah,
or what?
like the insecurities that people have, most of the time, like, it's inconsequential. People don't notice it, and like the only person who makes a big deal out of it is usually yourself.
Oh yeah, 100%, dude. Yeah, and people think one of the last things was saying this, but people will think like, oh, whatever I'm thinking right now, like, oh, I have this like blemish here or this fucking thing here, like, or oh, people know that I like am not confident right now. No one gives a fuck about you. Like, no one, everyone's in their own head.
Everyone's looking at themselves.
Yeah, everyone's busy thinking about their own shit that no one fucking sees you. So don't even worry about it. Yeah, that's a huge takeaway. And I remember telling somebody that at SGU one time, and like when an idea hits someone, when their eyes like fucking light up and they like look at you, And I remember just casually saying that we were in just the middle of some conversation. They're like, that really? And I'm like, oh shit, I just hit this person with a fucking stinger, son.
Atomic bomb.
And all that I learned at girlschase.com. Check it out, guys. girlschase.com.
Okay, the geniuses will see us now.
I'm a pro.
He's very unprofessional.
Very unprofessional.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum.
Doctor?
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 We're not doctors.
Are you sure they can handle this?
Oh, we can handle it. We're professionals.
You'll forgive us if we're not instilled with confidence.
Potentially unprofessional pieces of content.
All right, I got a video to show you. You ready?
Wow, that was a really long time until we played the intro. I was like, are we all playing this episode? We're gonna leave it out. We're gonna play it at the end and then the outro at the right after it.
Reform law. Attorney General J.D. Van Hollen says Wisconsin is the latest state, including Iowa, Kansas, Maine, Ohio, and Wyoming, to join Florida's suit. The states claiming the exorcist saw unto Stracho and Palais spring risk by health person.
What? Oh, okay, I hear it this time. So, like, after, like, Ohio, she just, like, goes off and starts saying nothing. I don't know, man. It's weird. Like, what does this title say? Possible on-air stroke or seizure / aphasia?
Yep, it's aphasia. So 10 years after, she had this on-air seizure 10 years ago, and she's trying to advocate for epilepsy awareness now.
Is this a diagnosed seizure?
Yeah, diagnosed seizure. So she'd been having seizures for 4 years, and then that's what she had, like, on air, because she had a brain tumor removed, and then it left behind scar tissue, so she was still capable of having seizures because of the scar tissue. And so she had that on air. I just thought that was kind of wild.
So, I don't know, like, honestly, like, before I even went to SGU, I had no idea what a seizure was, and I didn't know seizure could present like this. Like, honestly.
Bro, I had... You know what seizures? You know what I thought seizures were before I went to fucking medical school? I thought they were magic.
50%
like,
magic,
I still
50%
think they're
science.
fucking magic, dude. Like, what the fuck was that? If that's not being possessed by the devil, then I don't know what it is.
I'm sure back in the day, a lot of people got killed for it.
Oh, dude, so many people got killed for that shit. Dude, if I didn't know what the fuck was going on, and I was back in the day, I'd kill all them. That would be insane.
You're either killed or a messenger from God. that you're bringing
Oh,
information.
100%. Yeah. Oh, yeah. No, that's a good point. Yeah, you might be like doing Messiah or some shit on the other end of it.
But yeah, it's weird, man. I always like picture seizures being one thing where it's like you start shaking and you fall down.
Mm-hmm.
But man, after coming here, it's just like you could just be confused. You could just have like paralysis. You could just faint, like absence seizures where you're just like looking. Like it's crazy the different kinds of things you can
Yeah,
say,
it
and
can
like that's
present
why
in so many ways.
that's why medicine is so tough, because you have to like get all this information and then figure out what test you want to do, because like even just like fainting could be so many things.
Yeah, and so that's not even the difficult part of medicine, because okay, yeah, it might be hard to realize that that's a seizure, but now you have to do that with every single thing that it possibly could be. So if they have a little bit of confusion, now you have to consider everything. You have to consider seizure, which that's not even a main presenting thing, and then you also have to present or think of like stroke, fucking meningitis, goddamn everything, bro. It's crazy.
Yeah,
And then your whole
toxins,
differential,
man.
and then you have to start ruling it down. And it's kind of crazy. But
Do you think
pretty dope.
having the internet has helped people? Because people always come
Just
into like
overall?
clinics. No, not overall. Overall, it's harm, bro. But like people always come into the hospital and they're like, oh, so I Googled it and it gave me all these symptoms. Like I've had people come in probably 4 or 5 times in like my 4 weeks in family medicine, and the doctor always says, don't look at Google.
Okay.
So do you think
Oh
overall
yeah, you
it's-
mean to the patient?
Yeah.
But I don't know. That's a rough. That's a rough thing to tell somebody. I don't know if don't look at Google, but it's like realize that there's a bunch of stuff that's not really applying to you when it comes to Google and such. In fact, I have an article that exemplifies that like perfectly. So this is the title. Just tell me what you think right away after I say global temperature rising because of global warming, increasing the rate of hyponatremia.
What?
Yeah, that's what it says.
I feel like they made a lot of there was like 10 other steps in between those two things and they just like skipped them. And
Right. And they did do research on it, and so they found that there's like an overall increase in hyponatremia, right? But then it's also like, okay, it's giving them hyponatremia. What does hyponatremia do? Most of the time it does fucking nothing. Like it gives them 134 for their like sodium. Like they're gonna make it. You know what I mean? But someone looking at that who chronically has hyponatremia or something, or maybe not even not, and they're like, oh no, like it's warmer out and now I'm gonna fucking have hyponatremia. Then they Google hyponatremia and like, oh my god, it can cause seizures. Yeah, and this and that. Like, holy shit, you know what I mean? Whereas me and you were like, it couldn't mean less to you. Like this new information
can cause my brain to swell.
So yeah, I guess it is hard. Like there's so much shit out there, but what are you gonna do? Not look? Like it's also the greatest resource in the history of the world that we've ever seen.
I think it makes our job harder. People think they know what's going on and they think they know what they need. And people often come in and they say, I have this. I think I looked it up. I think it's this. I want this. Everyone wants antibiotics for like their stupid little colds.
Yeah, but people would want that anyway. You know what I mean? They would have heard from a friend that, oh yeah, my friend was treated with antibiotics, so I want it. You know what I mean?
Sure, but like people come in and this guy was like, my knee hurts, I need a CT scan, and like things like that. You don't know what you're asking for. Like I didn't even know what a CT scan was until I started like second year.
Yeah, that's very true. I didn't even know what a doctor did until fucking a few years in, honestly.
I thought the only specialty was surgery. I was like, what else?
Tell me what a fucking doctor does. I bet you ask you tell me first. What does a doctor do?
Me? I don't do jack shit, bro. And I'm a
all right,
doctor,
exactly.
so.
But yeah, anyway, like if you ask a random person, before I was doing it, I'd be like, you like heal people. You know what I mean?
Yeah.
You like lay hands on them.
You do something. Lay hands. You been playing Dungeons and Dragons, bro?
Fuck yeah, son. You lay hands and you heal their ass.
I think medicine, having it online is good, but I think you need to have a certain base understanding.
Yeah, and most people don't have that.
Yeah, I think you gotta like realize what the majority of people have. I think the majority of people stopped at grade 12. Whatever percentage that is. I don't think more than 50% of people go on.
Well, and their grade 12 is different than your grade 12 too.
What do you mean?
Like what I knew at the end of grade 12, I mean, I went to like a decent high school, you know what I mean? And my parents like forced me to like do okay in grades wise, and I was a little bitch, so I would be like, oh, of course I'll do that.
Yeah.
Whereas, you know, the average
I guess
person,
yeah.
that might not
Schools
have been.
like nowadays, I think like have gotten worse, honestly. And like
Wow, you sound old as shit.
you know, I see some of the videos on TikTok, and I'm like, man, I'm so glad I'm not in school nowadays. But
I think
you know,
yeah, that's like a symptom of like TikTok and stuff, like the shortened attention spans and
yeah,
stuff.
I don't know what it is, man. They're also like limiting a lot of stuff. I don't know. I just hope like I don't think we're improving. You know, like with the introduction of all this technology, I think it's taking away from like people.
But I mean, we are
and their
improving.
success
I
in
mean, you
school.
can't say we're not improving. I mean, the amount of poverty in the world has decreased so significantly. Like the amount of people with electricity and stuff in the world has blown up in the past.
Yeah,
like,
I guess
10
that's
years.
true. But
So
you know,
to say that all the technology is not helping is like a little silly.
but I mean, like, you know, those countries are whatever, you know, third world. I think there's nowhere to go but up. Like, it's harder to go down. But I think we should like just use, you know, developed countries, like the USA. Let's use that because that's where we live. And I think like for the most part, I don't know if it's like substantially gone up. And like back in my day, I think we were just getting into smart boards. Like, did you have those?
Yeah, we had smart boards.
We went from projectors to smart boards when I was in
Yeah.
school, and it was like a huge difference. It really improved the class. But now I think like people have their own laptops and stuff that they study on in school, and it's like, you know, when I was a teenager, I couldn't pay attention for that long to do this kind of stuff.
Yeah, but
I don't know,
bro,
man. I'm
think
not in
about it
school.
too. Like we went through medical school, we were able to put more information in our brains than ever before because
Yeah, that's also
we
true.
have the best technology ever in the history of the world. Like
That's true.
You know what I mean? All these different resources. We had Sketchy to put these dumbass little pictures in our brains so that we could be like, oh yeah, I know what fucking hyponatremia does. It can cause seizures and whatever, unconscious and loss of consciousness and this and that. Like,
Yeah, but I think we got so off track. I was like, the main point was, you know, the base level of understanding is so low that like people are not going to understand
oh yeah,
what
It's
like
true.
what they're
It's
reading
true.
when they see things. And you know,
It's
even for us, like a lot of stuff we can't find on the internet. Like, how often are you looking for an answer to a question and you have to read a research article to find it? Like, it's happened pretty often, and like the resources that you use, people don't know about, like Up to Date and like Amboss and things like that. Like,
Here's the
people,
thing. I just wish the resources were better out there for people.
Yeah,
I think that
100%.
people are able to like take that kind of stuff in and stuff, but the resources just aren't very good online. I think if we fix that, then it would be way better. In fact, if there's a primary care problem that we should fix, it's fixing like the Google search engine when it comes to health. You know what I mean?
Yeah.
Instead of finding just like this WebMD bullshit or whatever.
WebMD
You
is
know, where it's
terrible.
like you could be dying or this or that. Yeah, you could, but I don't like the seriousness of that in this situation. You have 134 out of 135 when it comes to sodium. You're gonna be okay.
Yeah, but like the common complaints, like for people that are like our age that are going to the hospital, like their complaints are not the same as like what we'd see in like internal medicine or something. You know, like I would go in for like pain in my throat, and I would have like canker warts, and like the doctor gave me a cream, like stuff like that. There's so many like small diagnoses that you can have that are like common problems that you need a doctor to tell you, because it could be 10 other
Yeah.
things.
Right, yeah, because like, oh, I'm looking at this wart. It could be goddamn a syphilis canker. You know what I mean? We
Or
don't
just
really
like
know.
common wart or cancer.
Yeah. Oh, I don't have to go all the way to the syphilis. No, yeah, I feel you. But still, I think if the primary source was better, and more chill.
Yeah, I think so.
And
I
it
think,
just would be like, hey, look, you probably should go in just in case it's this. You know what I mean?
Yeah.
Then it would be a little more relaxed, but it's all over the place out there. It's the
It's
fucking
tough,
Wild
man.
West on Google. Anyway, to finish up that girl's story, she like had to move in with her parents. She lost her driving license for like 5 years. But she said, I started driving last summer. Honest to God, I get excited when I get in my car like a teenager now.
What?
Isn't that just sweet?
Wow, that's amazing.
And that goes back to your cerebral palsy shit. Be thankful for what you got.
So this girl, like, after this, so the video you showed me was like 10 years ago, right?
Yeah, it was 10 years ago.
And so she can now drive a car.
Yeah, so she got her license back again, like I guess like.
Oh, so her
recently.
seizures are finally controlled then.
Yeah, so she's controlled her seizures with like not non-epileptic.
Damn, that's good. Like
Right?
honestly, like there's not that many medications to control seizures.
Mm-hmm.
And so, like, if you can't control it, you have to go to a lot of experimental things. So I saw actually a guy who was not controlled on any seizure medication. He was on experimental therapy. I don't remember what it was, but he was doing good on it.
I got another video for you.
Show me.
Share screen 1. Damn, it's smooth as silk. Without.
To be safe. They want them to do, everything on, but, it's...
You okay? Okay. What it does is it gives...
When they're in
Keep going.
the browser.
The producer's like, keep going. We gotta talk about this product.
We gotta sell these screens.
an internet browser.
Yes, this is
Oh my
all
God, that's so
Wi-Fi. And
funny.
what it does is, you know that your child is
Watch how this guy tries to save it multiple times. It's so fucking funny.
Wi-Fi, and what it does is you know that your child is safe because what it does is anything that is preloaded on here is kid friendly. Mom and dad have to access. Look at all you show here.
Her
You wanna
speech is
add
so slurred.
Another internet website. You have to have a password.
Okay.
So you cannot. Mom and the kids cannot do what.
She's trying to stabilize herself.
Tell you what
Man,
we're
she's
gonna do.
so confused.
Let me get this set up. Cassie, have a seat, sweetheart.
Aw, that's so sweet. I love how they're just like, no, let's keep fucking rolling, bro.
The
This is gonna be
producer's
fine.
like, we can't stop here. I saw there was a funny Key and Peele skit about that where like this guy just learned that his wife has been killed, and the producer's like, keep dancing. So funny, bro. And it's just like this. Like, I'm surprised at this guy that he wanted to finish the segment before like getting her help. Like she almost faints.
It's tough though.
Picks her up.
I feel like if you're put in that situation, you're just gonna keep doing the thing that you're already doing. If the person's like still like okay, you know what I mean? It's like, oh, can they get through it? I don't know what's really happening right now, you know. And that kind of
Yeah.
goes to just like, I don't know what this person's going through right now. Like
She
not
should have
knowing
stopped.
what a
Honestly,
seizure is.
I don't know why she kept going.
Well, like the last lady said in this article, when she was on air talking, she didn't even know it was happening. She just was like speaking gibberish. You know what I mean?
Yeah, I guess that's
So,
true.
I don't know about this lady who almost fell over, but yeah, probably similar.
Wow, that's heavy.
It's funny how we're about to be doctors. We're like, yeah, seizures. I think they're like this.
We are doctors now, bro. Stop
Oh yeah, that's right.
confusing the audience.
Well, it feels weird, bro.
Yeah. I think it's
Feels
gonna be
weird.
really weird when we start and we're like, hey, my name is doctor, whatever. I feel
Oh,
like we're not
100%.
gonna be used to it. Like, I'm a doctor, but treat me like a medical student, okay?
Yeah, for a little bit, 'cause I'm still a little bitch a little bit.
Take everything I
hold an
say with a
umbrella
grain
for
of
you?
salt.
Do you feel wet? I'll feel wet instead, so that you can not. Would you like that?
Yeah.
Will you like me,
feel like-
please?
That first month is gonna be so hard. But yeah, man, the seizure is like crazy. It presents in so many ways. It's just like it's such a mimic, She could have had a stroke. for
Well,
all we know.
that's another thing. It's hard to like. This lady's talking about. She wants to educate the public on epilepsy and seizures and stuff, which I think is awesome, right? But how
Don't
the
never
fuck
try
do
to
you teach-
educate the public, though.
How the fuck do you get to educate? First of all, no one cares. Like, I'm sorry, no one gives a shit. And then
Yeah.
two, no one's gonna be able to comprehend it. Like, if we're over here, like, oh my god, it presented so many different ways. Like, then everything feels like a seizure, and all of a sudden nothing feels like a seizure. You know what I mean?
Yeah.
It's like, how do you? People just aren't gonna know. It's just too hard.
I remember I had like a bunch of seizure cases when I was doing like a rotation in medicine, and like the attending would ask me the same questions every time, and I was always so confused because there's so many like details you have to see. It's just like crazy, man. You have to do a lot of things for it. You have to put a lot of precautions in place. It's tough to deal with seizures.
Neuro baby.
That's all I gotta say.
I like the emergency medicine approach to it. Just fucking let's shoot them up with
Just
benzo.
give 'em
baby.
benzos, man.
Give them that benzo.
What if the benzo doesn't work?
Guess what you do?
You tell me,
Guess.
man.
You give
You-
more benzos.
Me?
You do it 3 times, bro.
Can't go wrong.
If you
The
give a
right
bunch, it doesn't
answer.
work. You give it again, it doesn't work. You give it again, dude.
If they say benzos are the wrong answer, guess benzo again because it's
two
right.
more times. Correct.
There's no other answer. I've finally taken a step and I joined the R residency subreddit. Before I was in the medical school one, and now I feel like I'm ready to join the residency one.
Well, I was thinking throughout medical school and stuff, like, damn, there's like no resources for me to like look at to figure out this residency thing, and I wish I had like a mentor to tell me about this stuff. And now that I'm like, you know what, I'm gonna be that guy. I'm gonna tell them how to do stuff, and then I actually look for the resources myself because I'm like, all right, who are my competitors and stuff. There's so much shit out there. I'm like, fuck. I'm like, why didn't I just look?
I should have just Googled residency and I would have had all the
Googled
answers.
Residencies and such. Like,
I should have just turned on my computer once.
Yeah, dude.
And I would have had the answers.
Oh, man.
It's I think what I've seen on there is everyone's having the same issues. Everyone's like, our working conditions are shit. Our pay is shit. How are we going to survive? And a lot of people are talking about unionizing. What do you think about that?
I mean, it sounds like the next logical step, to be honest. I mean,
yeah,
I know people don't know. Like, people are like, oh, shut up, you're a fucking doctor. And you know what? You're probably right. But damn, bro, those 4 years or 3 years of residency, whatever you're doing, they look like fucking hell on earth.
Yeah.
It looks horrible. And everyone agrees with you that it's horrible. And you present how it is to anyone, and they're like, oh, that's the worst.
You know, people are saying that, like, oh, the patient care will be better if we have unions and, you know, decrease the workload. But I'm like, let's just forget about the patient care. Let's just do it for our own, like, mental health and, like, our own well-being. Like, first and foremost, I think, like, that's the most important. Like, why are we burning ourselves out helping others when it shouldn't have to be that way? Like, reduce our hours, you know, give us more pay, and a lot of those things will be solved. But I think, like, someone told me they give a 3 or 4% increase every year, or maybe less than that. I don't know. I'm not sure what it is, just to like keep us, you know, complaining but not like willing to do anything, because like we are getting raises. But
I'll never forget what they did at Jacoby, where it's three fucking doctors, 3 residents kill themselves, straight up murder themselves, commit suicide, and then, you know, everyone comes in the next morning, the attendings are like, you know, I'm really sorry, guys, like, but we have more patients to see now, so you know, good luck.
So,
it's instead of 9 hours a day, you're gonna have to do, you know, fucking 38. So good luck.
Yeah.
Yeah.
It's you know, I think I really want to join a union, and I think we need it. Even in Canada, like, you get treated like shit, so it's not like just a U.S. problem. But I'm just scared, you know. In the back of my mind, I'm like, I signed that contract, and I'm gonna be working, but, you know, they're gonna fire me. They're gonna get an IMG from fucking Nigeria or something who doesn't give a shit about unions, just want to come to the U.S. and make money, and they're gonna, you know, take my spot. And I'm an IMG too, so it's the same thing.
100%.
I don't know, man. I don't know if that's like
we're all replaceable, baby.
Yeah.
Although the U.S. government spent a lot of money on us, so.
Yeah. Well,
Well,
but
I mean,
you know, all these employers like Amazon and Starbucks go to such lengths to stop unionizing. Like, I don't know why we should expect hospitals to be any different. I feel like they'd be just the same. And
I mean, I talked to
line.
a couple doctors on the BS Free MD podcast, and they were like, "It's the next step." Like, I was like, "Oh, in your lifetime, do you think there will be unionization of doctors?" And they're like, "Yeah." I'm like, "Oh, that's."
In our lifetime, you know, that's quite a range. I think
no, in their lifetime, they're like in their like 50s.
Oh, they have
50s.
1 foot in the grave already.
Yeah, they're about to die. Yeah, yeah.
You know, I don't think it's fair that nurses have a union, but we don't have one yet.
Yeah, but there's like I guess there's like a bunch of them. That's why, you know. But
yeah.
I mean, yeah, we should definitely have a union as well.
I think
why not? Let's do it. Let's start it.
So people have started one. People have started. There's a bunch starting. I just don't think they're like up and running yet. But I'm surprised no one has done it yet. It's really like, you know, I wonder how like so many educated people weren't able to start it in the year.
Well, it probably took. I mean, it took like this scenario for it to happen. I mean, like EM physicians, at least, it's like they're outsourcing all of our work to physicians' assistants and paying them, like half as much. And you would think, oh, well, it's good for the physicians' assistants. But it's like they're just making it so instead of doctors, it's like a less trained profession. And then those physicians' assistants work extremely hard and get paid way less than they should be. So then it's like, okay, now they should unionize and they should get paid more,
It's just,
so either way,
they keep cutting corners, man. And there was an article that actually, like, per patient, there was a study done at a hospital. They had like 100 and something physician's assistants, and they found that over a course of like 5 or 10 years, the per patient, the people who were like NPs and PAs were spending an extra $40 per patient, and it ended up costing $10 million extra, like correcting for like the price, the salary difference. It still cost more to employ the PAs. Made? No, because, well, I don't know about mistakes. They didn't talk about that, but they talked about, like, you see something, you know what to do, but they don't see as many things, so they have to often refer out.
Oh,
and like
they
a
have
lot
to
of things that
refer
doctors
out
can
or
handle.
take
The
more
other people.
tests. Okay.
Yeah.
That makes sense.
You're not able to narrow down as well.
I can see that.
No one can do what we do, man. Like, it sounds kind of like full of yourself, but
I mean, it's true.
Yeah.
It's true. Like, there's a point where it's like, look, we can't just keep downsizing to like less specialized or less, I guess, I don't want to say intelligent, but people who've had less training, because it's just, you need this amount of training. Like, you fucking just need it. Maybe change it a little bit. Maybe we don't need to learn about glycogen storage disorders for step 1, but a lot of the other stuff we need to fucking learn.
I think, like, honestly, with everything that I've seen, like, in the hospital that hasn't been taught in med school, I think, like, we already got a lot of stuff cut out. Like, I don't know. I've seen a lot of disorders,
probably a lot
like
of bullshit
POTS,
before
like,
us. Huh?
Yeah, like postural orthostatic tachycardia syndrome. Like, I've never heard of that, and I saw that in the hospital. Like, there's another hemicrania syndrome. Like, there's a lot of things that you don't see that, like, we don't learn.
You mean that we see, but we don't learn more? Yeah. 100%.
Yeah, sorry, we see. They're rare, but we don't have to learn about them.
Yeah. No, I feel you there. On that note, let's talk about something related to what we were talking about. Ken, I have a question for you. If you have a patient who you believe is having a pseudo seizure, what do you do?
You're obsessed with seizures today, bro.
That's the theme of the episode. We're doing themes now.
What is a pseudo seizure?
You don't know what a pseudo seizure is?
Sure what that is.
I've learned it in the emergency department because we see it. I don't know about often, but we see it. It's essentially a fake seizure. Like, the person is, I don't know about pretending to have a seizure, but they kind of are. So they're like doing like movements and stuff like they think a seizure is, and like going, but then there's no postictal state. They're not confused after. There's none of the other shit.
Okay.
There's so it's like, okay, this is not a seizure. This person's just doing this for whatever reason, attention or what have you. It mostly happens in women in their 20s and 30s who are like stressed out.
Attention-seeking women, obviously. Cut that part out. I'm not sure, honestly. I think I've read about this before.
I guess it doesn't really matter to you because you're internal medicine. But
yeah, let me think. Like, I wouldn't want to give them benzos, obviously. Like, that'll help them, like, mentally, because they think that they're having a seizure and they get the cure and they're okay. Also wouldn't want to give them like a placebo or something, like pretend I'm giving them like benzo and then they get better. I don't know. I think I just do supportive care, like give them IV fluids or something. I wouldn't want to waste my time doing like a CT or MRI or anything. That's a big waste of resources. But I think like I know what you're talking about. Like the episodes are like the movements are not like rhythmic; they're arrhythmic, and I think like the eye movements are weird. There's no like they don't pee themselves, they don't poo themselves while they're having it.
No tongue biting going on.
Yeah, that too. And then the no like post seizure like confusion. But I don't know.
that you've pretty much said it. The amazing thing about these pseudo seizure patients is they never seem to hurt themselves. You know what I mean? Like a seizure patient, you know, you see them fall to the motherfucking ground and smack their head or whatever. You know what I mean? They're ripping their tongue apart with their teeth, and they're like, you know, they're like whatever their episode, they're like smacking their head against the ground. Like, you know, all these things could happen theoretically, but you never see that in a pseudo seizure patient. It's always a controlled fall. It's always this and that. So one thing you can do to diagnose whether it's a pseudo seizure or not, you know, if they're like unconscious or something, you like, one way is and this is the more gentle way, you take their hand and put it above their head, and then you drop it, and then it'll always fall to it around their head.
I'd never heard of that.
It never hits them in the face.
Yeah, have you tried it?
I have. It's kind of awesome. And then another way, which they used to do, and I don't know, I'm sure some people still do it, is they fucking take a saline, just like, you know, a shot or whatever, a syringe of just water, and they just shoot it into their eye.
What? Why?
Yeah.
Like
just because, you know, it's like
eyeball?
water hitting the eye. It's completely benign.
Oh,
It doesn't affect you.
Yeah.
But it's, you know, someone who's just had a seizure will not react to that, but somebody who doesn't, you know. So I guess that's like the most confirmatory way to see. But yeah, the hand way is kind of cool too.
So this is something that that you've seen a few times?
Yeah, I've seen it 3 times now, and I've done 3
And so-
EM rotations.
Was it like all women every time?
Always women, at least for these 3, and they were.
And so what did you do?
All between. They were all between 25 and like 40.
What was the treatment that you gave them? Anything?
We didn't give them shit. Just supportive care. We just gave them an IV drip and of fluids, saline fluids, and then just that's it. You just are like you reassure them and the patient, or reassure them and the family, because the family's always concerned and stuff. And you're, I don't know how I would explain to them that they're having fake seizures.
They're faking.
They're phonies. They're phonies.
Check their pants. There's no shit in there.
Yeah, they didn't poop themselves and then eat it. Look at them. No, but one time, this is like the second time I had seen it. The patient comes in, she's like thrashing and stuff. It says history of pseudo seizures on her chart. We're like, okay. And the husband's there. He's like, you know, he almost looks like he's just acting concerned. Like he's just like playing the part. And I'm like,
He's
was so
not a good
confused.
actor though.
And so I was just kind of like watching this, because I'm like, oh, it almost seems like he knows that this is just a fake thing, but he still has to play the part or his wife would be mad.
He's
so
just sick of her shit.
That's the idea I'm having. Anyway, this is happening, and I'm just standing there watching it, and he's like, are you going to do something? And I'm like, oh yeah, I probably should do something. But I'm like, do I just play the part? Like, do I just go, oh yeah, we need to do this now, you know? Like, or do I realize that she's definitely having a pseudo seizure? I mean, I guess it's possible she could be having something, you know. So I don't know for sure, but it's like she probably.
I've only ever seen real seizures, so I don't know if I could differentiate like a fake one from a real one, because I've never seen. One time, this guy asked me to take him to the bathroom, and I was walking him. He was super old, and he just like, I'm like, sir, are you okay? And I'm like talking to him for like, probably like 30 seconds. He's not responding to me. He's not moving. He's just frozen. And he just like starts slumping, falling, and I catch him, and he starts shaking in my arms. And I was like, Jesus, I was like, I need help. This guy's having a seizure. And like the nurses ran over. We put him in bed, and then like the boss jacked resident in the old hospital came over, and he like gave him some Ativan, and the guy got better after like 30 seconds.
And he just fucking picked him up with one arm and just
man, he was
started
jacked.
doing CPR with like his pinky for no reason.
He can go for a while on CPR.
Damn. That's
Have you ever had a patient come in where you diagnosed them and you just felt like a boss because no one else knew? It's hard to do, but
I don't know about no one else knowing, because there's straight up emergency medicine residents on the case as well. No, I guess nothing comes to mind right away. Have you?
I had one like a while ago. I was working in IM, but I was in the ED. Some guy came in and he was fucked. Like he had rashes all over his body and scabs everywhere. Like there was like bullae. I don't know how to describe that. It's like little
Like little
tenting of your
blisters.
skin, and underneath is like fluid. Yeah, I guess blisters is the best way to do it. And he's had them for a while. You know, he's getting cancer therapy. He's on some few different, one experimental therapy.
I already
for cancer,
know what it is.
And then what is it?
I can already diagnose him.
Tell me.
This is a classic fucking test question, if anything. Boy's got Joe Rogan syndrome.
I haven't heard of Joe Rogan syndrome. What are the symptoms?
Joe Rogan syndrome. You have bullae, rash. Your skin starts sloughing off. All that.
Oh, you know, one thing I didn't mention in the history, he doesn't do martial arts, though, so I don't think...
Oh, shit. He doesn't have commentary on different, medical things? No?
No, he didn't even watch MMA, though. That's the thing.
Oh, shit. Well, I guess I don't know, then.
So, I had a third year and a first year with me, and they were asking the patient questions, and I was like, man, this is a skin reaction. Come on. Are you guys going to ask the question? And so, the... third year was doing all the questioning, and he's like, okay, thanks for answering your questions. And I was like, I had my phone ready, my flashlight was on. I was like, can you open your mouth? And he opened it, and they're all walking out. And I looked in, and I was like, he has oral ulcers.
Oh, this is I know this. This is fuck. It starts with a V, right? Or has a V in it.
It has a V in it.
Yeah, I just don't remember the whole name. I'm dyslexic or whatever.
Stevens-Johnson syndrome.
I thought it's called. Oh no, yeah.
It has a V in it though, so you're right.
Mm-hmm.
So the residents came back. They looked inside, and they're like, "Oh yeah." So we went upstairs and we told the attending. They didn't give me any props for finding out the diagnosis, but I felt like God in the room that I'm the one who diagnosed him with SJS.
Maybe they did give you props. Do you know?
I don't think so. They kept calling me lazy, dude. That's all they ever said about me. He's lazy.
Oh, yeah, those guys.
But yeah, I haven't had a lot of those experiences because everyone knows so much. You're at the bottom of the totem pole. If it ever goes and missed, it's few and far between. If you're at a good hospital.
Yeah. Yeah, and even if you got it and they weren't really thinking that, they were like, well, I was getting this CT to cover just in case that something like that was happening. So it's okay, well, fuck, I'll just go shoot myself in the fucking corner. Just so useless.
Oh but God, I'm sure it'll happen soon.
Me killing myself?
Yeah.
Yeah, that's pretty much it, bro. The other day though, last thing, I had a patient all the signs and symptoms of pulmonary embolism, fucking 100 on the Wells score. And we're working her up for it. She's about to get the CT angiogram, but one of the EM residents is very like chill, and the patient asks, "Hey, can I go to the bathroom?" He's like, you know, and they're not supposed to stand up apparently because it could make it worse.
I didn't know that.
Yeah, I guess, I don't know. And then or maybe they just, you know, they're exerting themselves and that can like make them extremely short of breath or something. Anyway,
I would think that,
like,
or like another
right.
embolus like goes.
Yeah, maybe. It's like, all right, you know, we'll take the chance. Fuck it. So she walks to the bathroom. He's like, hey, can you do me a favor? Can you watch her and just make sure she doesn't, you know,
die.
I'm like, okay, thanks, I will. So she goes to the bathroom, kind of no problem, just, you know, stumbling a little. Goes in there, comes out, and she's straight up leaning against the wall, like
that's not a good sign.
Fucking slowly walking like a zombie. I'm like, this is not good, bro. I like threw my pulse ox on her to see what she was saturating for oxygen. It just was like, I think it was like 80 or something. Like, this is not okay.
That's not good.
I'm like, you need to lay down immediately. And then the pulmonologist comes in. She's like, what the fuck? Like, you should not be standing. And yeah, I don't know. It was funny. The resident's like, yeah, we took a risk. Like,
there's no remorse in there. Shit happens, you know. She needed to pee.
This lady is struggling to get back from the fucking bathroom.
Did she make it?
Yeah, she's okay.
I'm glad that at least.
But
you know, I think that's so important, man. Those small precautions. I feel like, you know, what a lot of people don't realize is that the big things are only like 50% of it. The other 50% is you're gonna get up, you're gonna be delirious, you know, at night if you're really sick, you're gonna fall. I'm gonna break your hip, or you're gonna get infection while you're in the hospital. Like, there's so many things that go wrong that you have to like take precautions for. Like, someone beside you in the next room could have COVID and you get it, and you deteriorate. So you
That's
gotta like
true.
look out for all these other
Or
things.
you have
like,
no risk of getting blood clots or anything, but you know, you come in and you have whatever, a headache, and you're being seen for that. But if you lay in bed long enough, you could have a fucking DVT. You could have a deep vein thrombosis in your leg after a while. So we have to give you precautions for that. We have to give you goddamn blood thinners to make sure you don't have a goddamn blood clot, even though you've never had it before and you're a healthy person. It's like crazy.
your skin's gonna start wasting from staying in bed all day, like getting ulcers. Like, man, there's so many things you have to take care of.
You're right. I mean, as much as I kind of like shit on us and doctors, like a lot of fucking shit we got to think about. It is not like a simple process.
Yeah, and you know, I think it's hard. People have so much like autonomy that they're used to. They're like, oh, you know, I'm going to go to the bathroom. I mean, if you tell them not to, people do that all the time at the hospital. But like, I think as a doctor, you should be like telling people, you know, we don't recommend it. Things get worse. You know, you're
and imagine being
stable.
a doctor and you don't have like self-respect for yourself, and you're the guy who like holds the umbrella for, you know, a couple, and you get wet instead. Now you have to tell this person that they have to stay in bed and they can't be autonomous and like go to the bathroom themselves. I mean, if you don't have the self-respect for yourself as a doctor to do that, you're not going to do that when it comes to like game time. You know what I mean? It's like, this person needs to stay in fucking bed. It's like, you need to tell them with like a downward inflection in your voice, you must stay in bed. Like, boom. It's not like a, do you really need to go, or that kind of thing. It's like, you are fucking staying in bed because I don't want you to die, you know? And so it's that's where like the whole courage thing comes back again.
I think
that's how we loop shit back on this podcast. That's how we keep things in sync. And that's how we pull it all together.
I was going to say something else, but you know, it doesn't. No, it honestly, it doesn't fit. You ended it so well. You closed the loop. There's nothing more for me to say.
I'm the closer, baby. They call me the closer. And you hear the outro music. That's what it is. Thanks for calling on Professional. You guys have a great week. And don't have any seizures. Don't get possessed.
Live it up.
Deuces.
But not too much.
What do I do with my
Don't be a simp.